Hi guys, welcome back to LearnBiology.net. I'm Frankie, and in this revision session, we're going to take a look at tuberculosis. And your learning outcomes are: number 1, know that pulmonary TB is a communicable infectious disease caused by the bacterium Mycobacterium tuberculosis. Number 2, describe how TB is transmitted. Number 3, explain how the immune system responds to TB infection. Number 4, understand how TB affects ventilation rate. And number 5, understand that secondary TB infections are a major contributor to mortality rates in immune-suppressed patients. For example, AIDS patients. Tuberculosis, TB, is an infectious disease caused by the pathogenic, the disease-causing bacterium Mycobacterium tuberculosis. Typically, infection arises as a result of droplet transmission, whereby an infected individual expels the bacteria whilst coughing, hence TB is a communicable disease. Remember, communicable diseases are those that are transmitted from person to person, as opposed to a non-communicable disease such as asthma or cancer, for example. Upon inhalation, a healthy individual normally fights off infection as the macrophages, the phagocytes, are activated. If bacterial numbers are low, macrophages deal with the bacterium with relative ease. However, if the bacteria are not destroyed by the immune system and the microbial load, the number of bacteria, is quite high, it is in fact the phagocytes that offer a refuge for the infectious agent. Here's what happens. Step 1. The TB bacteria are inhaled by droplet transmission. Step 2, the bacteria reach the alveoli in the lungs. Step 3, cell-mediated immune response enlists the phagocytes, which engulf the infectious bacterium, but often the bacteria survive. Step 4, more macrophages, phagocytes, arrive at the infection site, activated by cytokines, which have been released from macrophages at the infection site. A cytokine is a protein released in response to bacterial infection. And these phagocytes, these macrophages, engulf and surround the bacteria. Step 5. After a few weeks, the macrophages actually begin to die, releasing the bacteria, which leads to the development of a walled-off lesion, a hard lump, known as a tubercle, which actually means hard lump. The bacteria may lay dormant here for years. Step 6. However, when the bacteria divide by binary fission, this lesion, this tubercle, begins to enlarge and causes rupturing of the alveolus and the bronchial wall. The disease is now highly contagious. The bacteria are able to enter the bronchiole, where they are coughed up and transmitted via droplets expelled into the air. So we know how TB is transmitted, and we know how the immune system responds. But what effect does this infectious disease have upon an infected individual? Well, firstly, we'll take a look at the common symptoms, i.e. persistent cough, usually including the coughing up of blood and mucus, which is accompanied by chest pains, fatigue, and of course, shortness of breath. From those symptoms, and of course what we know about the transmission and immune response, it's now easy to understand how TB affects ventilation rate. For example, the bacteria have caused alveoli and bronchioles to rupture. The damage caused to the gas exchange surfaces has caused a decrease in tidal volume. The damage caused also results in the formation of scar tissues, fibrosis, which reduces tidal volume even more. Now, since tidal volume has decreased due to the effects of the disease, the infected individual is not able to inhale oxygen as efficiently, hence the shortness of breath. So ventilation rate increases, i.e. the affected person breathes quicker in order to try and take in more oxygen. What I've just outlined here is a primary infection caused by the TB bacterium. It is important to recognise here that despite TB having one of the highest mortality rates of the infectious, the communicable diseases, healthy individuals are typically able to combat this bacterial pathogen with relative ease. So why are mortality rates so high? Well, TB is an opportunistic microorganism and commonly presents as a secondary infection in patients with a suppressed immune system. For example, AIDS patients, the elderly, children, the malnourished, etc. And that, guys, brings us to the end of this revision session looking at the key points of TB. The important points to take from all of this are: 1, be able to describe the transmission and course of infection of pulmonary tuberculosis. 2, know that TB reduces tidal volume and increases ventilation rate. Give reasons why. And 3, understand that TB is a major contributor to mortality rates in immunosuppressed individuals. So until then, as always, take it easy.